About a year ago, I was diagnosed with Hashimoto's thyroiditis, which is an autoimmune disease where your immune system creates antibodies to attack your thyroid gland. And so I thought I'd make this video, kind of talk about the symptoms that you may have and also the treatment and what to expect. Since I've been having the treatment for a year, and I'm a whole new person. I have a whole new life. I'm so excited. So the first thing that you want to know is that you have to go to a doctor to be diagnosed for this. You may have a lot of symptoms, and I read the list of symptoms, and I thought that's me. And there's a lot of different symptoms, very different symptoms that really can range. You may have some, you may not have others. And so I thought I'd do this, kind of go through and explain my experience with this all. The biggest symptom that I felt, and I felt it almost my whole life, probably my entire life, was that I was absolutely tired all the time. Wouldn't matter how much sleep I got, wouldn't matter what I ate, I would just be tired. And I just kind of got used to, thinking I was lazy. I honestly said, well, I guess I'm just lazy. And so that's kind of the way I went through life until I had enough kids and life got so demanding that I couldn't function at all anymore. Life's a lot easier. You could do, with no kids, you can get a lot done and still feel like you're fine, even though maybe you sleep more. So once I got to this point of life kind of crashing down on me with demands of just normal life, I decided to go to a doctor after I realized and read all of these symptoms. So I'll go through some of them and give you my experience. But the biggest one was that I was absolutely tired all the time. Dryness and roughness of skin. I have very dry skin. My scalp, I would have like dandruff. I had big cracks in my fingers on the corners. All that, definitely. Hair loss. Now, I'm bald. This is probably more like male pattern baldness. So, but one of the things that is a symptom with hair is the outer third of your eyebrow. Some doctors say it is, other doctors say it's a load. But, if you have a combination of these symptoms, go get yourself checked. So the outer third of your eyebrow thinning or gone or almost gone is a symptom. And I have thinning outer thirds of my eyebrows. Also common, constipation, but I'll get to that in a minute because there's something with the foods that you eat and having Hashimoto's that can be a problem. Depression. I was never really depressed. I was tired all the time, but I was never depressed, so that didn't affect me. And a large thyroid. I don't have that either. It's a butterfly shape gland that kind of wraps around your neck, and the doctor was feeling and was kind of surprised that I didn't have anything obvious with my thyroid. Fatigue, kind of covered that. Joint stiffness, joint pain. I had the worst knees. My knees don't bother me anymore, but I would have joint pain regularly. It was really annoying, and I haven't really had that anymore. Muscle weakness. Along with feeling lazy, I always felt weak. Puffy eyes. I guess around here I kind of did, but what was more obvious that I don't have now is a swollen tongue. That is a symptom. Why? I don't know, but you do. So it could just be because it's so close to your thyroid. I don't know. Sensitivity to cold. I hated the cold. I absolutely hated being in the cold. In the winter, I moved from California, Bay Area, California, gorgeous, perfect weather, to the Salt Lake Valley, Utah, which has seasons. California, you kind of wear shorts in the summer, in the winter. In Utah, it gets really cold, and I was just absolutely unbearable. And I felt wimpy and weak because other people were doing fine. I was always putting wool socks on, wool coat, Just really had to wrap myself up in the winter. Hated it. Um, uh, Along with that, I would have headaches all the time. And I got to a point where I could identify what kind of headaches. The weather would change, I'd get a headache. All of that was a pain. Slow heart rate. I've always had a low heart rate. And also a low body temperature. I've always had those two things. And since having treatment, both of those have become more normal. It was never at a dangerous point, although your body temperature being too low is dangerous for your immune system. Swelling in the extremities. I never really had that. Weight gain. Obviously, I'm still overweight, but I'll talk about being able to exercise and work out. Before I had treatment, I would get to a point where I'd say my willpower would drive me to say I need to go exercise and work out. And that would last for, about a month. Usually 3 weeks would go by, and then I would be so exhausted and I'd get sick, and then all that willpower is out the door. I had no desire to exercise. And that would happen over and over and over again. It was just, I would count on getting sick if I started exercising. So all this, it affects your mood as well. Just being maybe a little more short-tempered or angry, because your adrenal glands are being shot. Because your thyroid regulates your energy, your metabolism, all this stuff. And so if that's having a hard time, then you're depending more on your adrenal glands to provide you with energy, which is where you turn to things like caffeine. And caffeine stimulates the adrenal glands, releases adrenaline, but over time you get burnout that way. So gluten sensitivity is also something, and I only just recently learned this, even though I've been diagnosed for a year. So it's worth getting multiple opinions, because the thyroid is not an exact science. Well, it is, but there's not enough known about it. And so there's still a lot of discoveries being made. Some doctors kind of shy away from treating it. So you just got to find the right doctors that are willing to look and see. So I had the test done. There's a few tests you can have done to help indicate what the function of your thyroid is, and if you have an autoimmune disease. Well, you can also get a false negative, meaning your immune system, you may actually have antibodies against your thyroid. However, they're not present at the time that you took the test. So I took the test, they were present, and I was prescribed a thyroid replacement hormone. There's a few different kinds. Some are synthetic, some are natural. And by natural, I mean it comes from another animal, in this case, a pig. It's a desiccated or more or less a dehydrated thyroid. Back, and I believe it was the late 1800s, they discovered that if they made a broth out of the thyroid of a pig, they could treat people with low thyroid. So that was the one that was prescribed to me, and it was a sublingual thing. I felt a difference within about 12 hours of the first dose. And you have to titrate up, meaning you have to take a small amount and take more and more and more. And it was shocking to me how quickly I felt the difference. I'm a whole new person. I have way more energy. Another symptom that is huge, I can't believe I forgot this, is because I haven't had it in so long, is brain fog. Just absolute inability to concentrate, focus for very long, remember people's names. So I would go to church, people that I've been around for years, and I couldn't remember their names. So I would always say, hey, how's it going? Never called anyone. I felt terrible inside. But now I remember people's names. So those are some things that are symptoms. The treatment, within a few days, for me, it was amazing. Now, some people have to go on different types of thyroid medication. If one's not working, but you verified that you have a thyroid problem, then try another one or be willing to try another one, because there are some different factors. Now, I will say gluten, I wasn't told this when I was first diagnosed, but the doctor that I recently went to suggested I go off of gluten because the gluten molecule looks suspiciously similar to the thyroid hormone molecule, and your immune system doesn't really tell a difference between the two. So if you're eating bread or any wheat-based product, any grain with gluten, your immune system is creating anti-thyroid antibodies. So now this is for people with Hashimoto's, not just low thyroid. So I've been off of gluten for about a month now, and I do feel like I have more energy. I'm eating a lot more healthy, and so I'm getting thirsty though. Let's get a drink here. Out of water. But I've been able to exercise. Even if I get sick, I've been able to exercise. My mental clarity is definitely there, and I just feel so much better. I have so much more energy. I'm sleeping better at night. My tongue isn't swollen so much. Let's see, my skin is better. I don't really have any joint pain unless I'm doing something that would merit having joint pain. And so now that I've been on this gluten-free diet, I haven't lost weight really in the last year. But even with exercise, I was exercising at one point 2 hours a day and kind of watching what I ate. So now I've been eating right, meaning no gluten, for a month now. I'm going to start exercising. I wanted to get that foundation of eating right in first before I started exercising. So anyway, let me know if you have any questions about Hashimoto's, about treatment or the symptoms, but it's definitely worth looking up and seeing what you can do if you're experiencing any combination of those symptoms or somebody you know, because night and day, I'm alive. I really felt like I was going to get cancer and die when I had, months before I went to that doctor a year ago. I was like, I guess this is just the way it is, and this is the way I'm going to be, and I'm so tired that I'm probably going to get some disease and die, some cancer and die. So that's not the case anymore. I don't feel that anymore. So honestly, if you have any suspicion that maybe your thyroid is to blame for lack of energy or any of those symptoms, go get yourself checked out, and hopefully it will help you live a better life. Thanks for watching. Let me know what your thoughts are in the comment section below, and subscribe. I'm going to be doing more videos about gluten-free, living with Hashimoto's, all that stuff in the future. So have a good day. Thanks.